Jai Hind, this is Cadet Janani from 3x4 Company 4 Karnataka Battalion Tumkur, and I'm here to present a small video regarding COVID-19 awareness. First of all, the symptoms of COVID-19 are fever, more than 38-degree, cough and difficulty in breathing. If you have these and you are in contact of a laboratory confirmed positive case, immediately call the state helpline number of Ministry of Health and Family Welfare. As we all know, prevention is better than cure. There are some steps of prevention of COVID-19. The first step of prevention is hand hygiene. So wash your hands often with soap and water for 40 seconds, especially after you have been in a public place or after blowing your nose, coughing or sneezing. Use a hand sanitizer, at least 70% alcohol based. If soap and water are not available, cover all surfaces of your hands and rub them together until they feel dry. And do not touch your eyes, nose and mouth with unwashed hands. Touch surfaces like door knobs and doorbells, etc. If you touch all these things, kindly wash your hands as soon as you go out of there. Second step of prevention is respiratory hygiene. Use a handkerchief or a tissue to cover your face while coughing or sneezing. Throw the used tissue immediately into a closed dustbin and cover your sneeze into your bent upper arm in case you are not carrying a tissue or a kerchief. Wash your hands immediately after you have covered your sneeze or cough. Third step of prevention is social distancing. Stay at home unless absolutely necessary. Keep a distance of at least 1 meter between yourself and another person. Do not hold events where people have gathers. Do not go to crowded places like markets. Modes of transmission are cough by infected person, infected droplets which will get into your hands, and when you touch any surface or person, virus has been transmitted. Even after all this prevention, if you have tested positive for COVID, quarantine yourself, keep distance, stay in a well-ventilated specific room and away from other people in your home. Restrict movement. If available, use a separate bathroom. Avoid visitors in the house, because if infected, you can spread infection to others. Although for the self-quarantined person, family support is very important. There should be a member to take care of an infected person, helping them follow doctor's instructions for medications and care. The COVID-19 health crisis is like an ever-rising tide, testing patients' energy and forcing people to distance themselves from their day-to-day social routines. It's too mandatory to fight against COVID-19 in this pandemic situation. And at last, thank you one and all for being a good listeners. Jai Hind.